I think the most unique feature of St. Mary's program is that residents are exposed to a huge variety of different illnesses.
I love my program. We are very independent as residents. They give us a lot of autonomy.
The most appealing thing about this program is the diversity of people that it brought. The 30 residents here are all from different parts of the world, different parts of their training.
What captivated me about the program was really the fact that there was a big emphasis on how to think through problems, and that really fascinated me. The idea that you could accelerate somebody's thinking and teach somebody how to be an expert within a shorter window of time.
So we're 30 residents, and I think part of that is quite important how we operate. And in fact, people that come to our program will have significant amount of both supervision and cohesion with our faculty.
Everybody is so approachable. You get to know people, they get to know you. Even if I have to message or text my program director or any of the subspecialty people, I can do that without hesitation.
The benefits of being a small program would be like it's more personalized. Your attendings get to know you more. Being a small program also makes you feel like closer to your colleagues.
We get to interact with our attendings on a daily basis, and they have been very supportive and helpful.
As training doctors, we need guidance, we need role models that we can look up to, and the core faculty, our program director and associate program director give us those open doors.
It's kind of very close relationship, and we get feedback very frequently so we can improve our skill and knowledge.
St. Mary's is a community hospital, been around for quite some time. Actually, the medicine department and the residency program has been there since the 1960s. We're a 350-bed hospital. We have about 200 beds for internal medicine alone, mixed with surgery. We have a OBGYN university-based program as well.
The thing about St. Mary's is we live right on the border between St. Louis City and the county. St. Louis has a pretty wide diaspora of different patients because it's a city that has a lot of history by itself.
I do love our location. St. Louis is a city with different things you can do, many activities outdoors, including good places where you can eat and have fun. It's not only about studying, but also have some time for yourself.
I believe St. Louis is also called like a 20-minute city in which you can get anywhere within 20 minutes, which is amazing.
There is a lot of things we can do in St. Louis, and it's a pretty vibrant city. My family loves it. We definitely feel like home here.
We have a resident-run internal medicine clinic right on campus, which is run entirely by residents, supervised by the attendings. The thing about that is we are the primary care physicians for these patients. We are really their doctors.
We really foster ownership of your patient. No matter what time of day, no matter what's going on, you will be there for your patient, and the patient knows that. And that's quite important to develop that sense early on in residency.
Clinic is probably one of the more fun rotations in our schedule. The longevity of care, we get our panel in our first year, and we see them routinely for the next 3 years. And the diversity of patients is great.
The time from when you're first year resident and towards when you're third year resident is very challenging. And you learn how to be a doctor, how to be a resident.
In residency, there's always a balance between supervision and autonomy. And obviously, the autonomy is earned. And most of our residents are really capable of achieving that.
I'm confident that we get well prepared for what the world is gonna show up once we're out there. I think the experience we have, the journey that we get here in the program leads us to feel more confident and feel independent to work, as sole physicians and be prepared.
This is a solid program, which is an old program, which had been around for more than 30 years. It allows people to gather very solid experience and extensive experience.
When you come as a first-year resident, you are more learner. In the second year, they prepare you to be leaders. And then in the third year, you most have to technically behave as an attending and be prepared for something next level and handling everything.
Dreams can come true. I definitely will say that St. Mary's is a good place to grow and to learn.
The pleasure that I get to see them graduating and to become a full-blown internist, the complete package. Then they will move on and they will take care of thousands of people.
If you are one of those person who wants one-to-one time, or you want less people and more guidance, then this is the right program for you.
I think I'm prepared to actually fly to the real world and start my practice on my own.
If you walk into residency with the preparation to work hard, and if you embody a growth mindset of what can I learn from this, what can I do better, or how do I make the most out of this situation, you'll have all you really need to succeed.